Good morning. Thank you all for participating in today's media briefing. This is our 31st since the start of the pandemic. These press conferences are a reflection of UPMC's ongoing commitment to provide timely and accurate information for all. I'm joined today by Dr. Graham Snyder, Medical Director of Infection Prevention and Hospital Epidemiology at UPMC, and Dr. Aaron McCreary, Infectious Diseases Pharmacist at UPMC. They'll explain how UPMC will be expanding access to a COVID-19 outpatient treatment so that it can be used for prevention of the disease. They will also discuss how this virus has evolved and how we continue to keep our patients, staff, and communities safe. After their remarks, we will take your questions. Dr. Snyder.
The virus that causes COVID-19, SARS-CoV-2, has continuously emerged with new variants or collections of genetic mutations since it first broke out. We always expected a virus that would change in how easily it passes from person to person, in the severity of illness it can cause, and potentially in making vaccines and treatments less effective. It takes discipline and persistence to thwart COVID-19's evolution. The Delta variant has been circulating globally and is now in every region UPMC serves. It is more contagious than previously circulating variants. This is a particularly dangerous time since we are taking fewer precautions like masking and distancing than we ever have during the pandemic. Staying safe from the Delta variant requires the same response we've established over the last nearly 18 months. Masking and distancing work well to prevent transmission. Vaccination is safe and highly effective at preventing serious complications. Early diagnosis and contact tracing can slow the progression of the virus. Treatments, including monoclonal antibodies, save lives. When you arrive for care or visit a loved one at a UPMC facility, you will see us use the same pandemic-tested safety measures we've been using since spring 2020. We ask that if you're visiting a UPMC facility for any reason, wear an effective mask. Masking remains an important layer of protection, particularly for those who are vulnerable to complications of COVID-19 and those whose immune system may not respond to vaccine. The vaccines that are currently available, J&J, Moderna, and Pfizer, are effective against the Delta variant. We don't expect them to provide perfect protection, but they do exceptionally well at preventing serious complications like hospitalization and death. And I cannot stress enough how safe they are. The initial clinical trials were thorough, and now hundreds of millions of people have received these vaccines. While they're going through the federal government's authorization and approval processes, they are not experimental. Without question, unvaccinated individuals of any age or any health status are in greater danger from the Delta variant, to themselves and others. Vaccine protects you and the loved ones around you. At the peak of the pandemic in December, UPMC had about 1,200 COVID-19 inpatients across our health system. We have about a tenth of that today. Vaccination is a cornerstone to blunting the impact of the pandemic in our communities. We strongly encourage everyone in our community who is eligible, including our healthcare workers, to get vaccine as soon as possible. We continue our work with our community partners advocating for vaccination in under-resourced neighborhoods to reduce health disparities. There are many places to receive vaccine. You can find information about the vaccines at vaccine.upmc.com. If you test positive for COVID-19, even if you don't feel seriously ill, contact us. We can help. UPMC is leading the way on monoclonal antibodies, a life-saving therapy that works even against Delta. My colleague, Dr. Aaron McCreary, will now tell you some exciting news about monoclonal antibodies and how we expect to use this treatment to prevent disease.
Thank you, Dr. Snyder. As we've shared before here, UPMC is dedicated to giving monoclonal antibodies, a treatment that, if given within 10 days of the onset of mild to moderate symptoms, decreases the likelihood of hospitalization and death. In fact, our early published data show that our hospitalizations and deaths in our patients were decreased by 60% in patients that received antibody therapy, and even better if given even earlier. So as Dr. Snyder said, call us right away. We currently offer 2 monoclonal antibody treatments. One is casirivimab and imdevimab, and the other is sotrovimab. We are the first healthcare institution in the United States, to our knowledge, to treat a patient with sotrovimab under the FDA's emergency use authorization. Both of the monoclonal antibody treatments that are available are active against the Delta variant. And I'm very pleased to share that the FDA recently expanded the emergency use authorization for casirivimab and imdevimab to include patients who have been exposed to COVID-19 and have a high risk of getting severe disease. So UPMC will soon offer this antibody treatment as something called post-exposure prophylaxis. We will offer this in outpatient and inpatient settings, our senior care communities, and urgent cares for all eligible patients. And so what it means to be eligible for this post-exposure prophylaxis is, first and foremost, you must be exposed to someone with COVID-19, which is defined in the community by our public health officials or the CDC, and at our UPMC facilities by our local infection prevention colleagues like the fabulous Dr. Snyder here. So with the exposure, you also need to be either not fully vaccinated, which would mean that you have not received your second dose, or you are within 2 weeks of your last dose, and so you haven't achieved that full immunity yet, or you're unvaccinated, or you have a compromised immune system, like our solid organ transplant patients. And then you also have to have a high-risk criteria for severe illness from COVID-19, whether that criteria be your age, body weight, or a chronic condition such as diabetes or kidney disease. This post-exposure prophylaxis treatment will be administered through the vein or as an under-the-skin injection, whichever the patient prefers. And again, we'll be offering this across the UPMC enterprise to any patient ages 12 and up who would qualify. We will soon share more information with all clinicians and our communities as soon as we can to access and about how you can access this therapy. I do want to take a moment to emphasize that while this preventative therapy is very, very exciting and promising, vaccination remains the most important way to protect yourself and your loved ones from the serious health consequences of COVID-19. We strongly encourage everyone who is able to receive a vaccine to do so as soon as possible. The expansion of monoclonal antibody use is an example of how UPMC and the University of Pittsburgh have been at the forefront of developing and implementing transformative therapies to treat and prevent COVID-19 throughout the pandemic. Just last week, our physician scientists had 2 studies published in the New England Journal of Medicine, which share trial results that included UPMC patients. UPMC has been part of a global collaborative, the REMAP-CAP trial, which is an adaptive platform trial that has transformed standard of care for COVID-19 patients by testing possible treatments and finding answers quickly. We were, in fact, the first center in the United States to join this global trial. Because of the latest publications, we now know that the blood thinners enoxaparin and heparin may keep moderately ill patients with COVID-19 from progressing to more critical illness, which helps them leave the hospital sooner. We also know, based on these results, that critically ill patients, so very sick patients in our ICUs, should not receive these blood thinners because they did not benefit, and in fact, they may have caused harm. So later this month, we expect to share interim results from our Optimize C19 trial, which is the largest adaptive platform trial in the world, comparing different monoclonal antibody treatments. We're using UPMC's learning while doing approach to get answers on the best treatments for patients, both now and in the future. We remain committed to sharing our findings in real time so that all patients can receive the best possible evidence-based care.
Okay, thank you, doctors. And now we'll take questions from the media. To ask a question, you'll have to go to the participants icon at the bottom of the page and press the raise your hand button. That will put you in our queue. I will read your name and your line will be unmuted for you to ask your question. Please remember to unmute the microphone on your end. We will try to call on as many different media outlets as we can in the time we have allotted. And with that, again, press the participants icon to be put into our queue, and we'll go from there. I do have an email question that I'd like to ask Dr. McCurry. If I test positive for COVID and I've been vaccinated, can you tell from this test if I have the Delta variant? Can I still get the monoclonal antibody prevention treatment if I've already been vaccinated?
Thanks for the question. So at this point, based on the local and national epidemiology of COVID-19, we have to assume that most patients have the Delta variant. We do not routinely determine the virus type when a patient presents sick because that test takes a little bit more time to come back with a result, and we need to make treatment decisions faster than that to treat patients as soon as possible. Our current treatment strategies don't change based on the variant. They only change based on how sick you are when you present. So we may treat a mild patient somewhat differently than a critically ill patient. And I want to reiterate that the vaccines are highly, highly effective against the Delta variant. To answer the second half of the question about monoclonal antibodies, so the use of monoclonal antibodies as a preventative treatment is approved for patients, again, who are, number one, exposed to a patient with COVID-19, and then two, they are unvaccinated or not fully vaccinated, or they have an immunocompromising condition, again, such as our solid organ transplant patients is probably the best example of that. We do offer monoclonal antibody treatment as a treatment for patients who acquire COVID-19 to anyone who meets the criteria, and that would be regardless of your vaccination status. If you have any questions about the use of monoclonal antibodies, you can call us, you can visit upmc.com/MAI, or you can talk to your local doctor.
Thank you, Dr. McCreary. First question we'll take from Gabriella DeLuca at WPXI TV. Gabriella, please go ahead.
Hi there. Thank you so much for taking my question. I have two really quick ones, if you don't mind. The first one, do you have any guidance for schools making their masking policies for the upcoming year? And we just heard from you guys about how safe the vaccine is and how everyone should get vaccinated. Has UPMC changed its policy when it comes to mandating employees to get vaccinated? If not, why not?
Dr. Snyder?
Yeah, let me tackle the first one about vaccine mandates, and we'll talk about schools as well. I want to be really clear. As a hospital epidemiologist, as an infectious diseases doctor, as somebody who has loved ones who are vulnerable to complications of COVID-19, I want everybody who's eligible to get the vaccine to be vaccinated, period. And at UPMC, we're doing what we can to make vaccine as widely available as possible to reach the communities that we serve and to educate people about the safety and efficacy of vaccine. Vaccines matter. They are having an important impact already on the pandemic, and the more of us that are vaccinated, the greater that impact will be. That being said, our approach at UPMC is to build trust among our healthcare workers and among the community that we serve. It's important for us to understand and have some empathy about why people are not getting vaccinated, because as we've been talking about, there's more than one reason. There's many reasons. And some of those reasons make sense to the people who believe they want to wait to get the vaccine or avoid vaccination. Our job is to meet people where they are, build trust, educate people about the safety and efficacy of the vaccines, dispel myths, make it available, and help people see from their own communities and hear from trusted people that vaccines are important. If we can get people vaccinated, if we can get to a maximum vaccination by building trust, we'll be better off for this pandemic. We also want to attend to health disparities. People who are vaccinated and people who are not vaccinated are not the same. And we need to understand how our vaccination approaches may exacerbate or alleviate these health disparities. So we see as part of our mission for our communities is to help minimize health disparities, particularly related to the COVID-19 pandemic. And to respond to this pandemic, it's not just vaccine, as important of a role as vaccine has. I'll go back to what I said at the very beginning of my comments. We have to keep masking and distancing because masking and distancing prevents transmission of the virus. Vaccine has an important part to play in preventing serious complications, and it plays some part with transmission too. And this is not just to protect us in our communities, but this actually has to happen across the state, across our regions, across the nation, across the globe. Now, as far as schools, we have been navigating with our public health and our governmental officials throughout this pandemic the right approaches from a public health setting, whether that be in healthcare, in schools, for vulnerable populations like those in senior communities. in our other workplaces. We're going to continue to see evolution as the pandemic waxes and wanes. I just want to go back to the key points that we're trying to emphasize here, that vaccination plays an important part, masking and distancing plays an important part, and increasingly we have to make decisions for ourselves, for the loved ones around us, and in the communities that we're talking about, whether that community is a school, is a workplace, is an office clinic, is a hospital. So I want people to think about vaccination and masking and distancing as two layers of protection that work together. And the decisions that those who are leading our schools' policies, I want them to think about masking and distancing together as possibilities for keeping people safe. Now, the good news is we have effective therapies, but we don't want to have to rely on those effective therapies. We want to prevent transmission from even happening.
Thank you, Dr. Snyder. Next question, Amy Wattis, KDKA. Amy, please go ahead.
Hello, thank you for giving me the opportunity to ask some questions. I first want to ask you, are you concerned about hospital capacity increasing with the Delta variant, particularly in the fall? And are you concerned about this virus continuing to mutate the longer, we go with unvaccinated people out there to the point where the vaccine won't work anymore?
With the Delta variant circulating in the United States and now in our regions, we expect activity to increase. I don't think that the activity will be as bad as it was in the winter. Right now, we have a tenth of the volume that we had in the winter. We have the ability to care for people. We did well throughout the winter in the very worst time of the pandemic. We don't anticipate having any difficulty providing care for those who need it. And that care is whether you have a chronic medical condition that you need care. We don't want you to delay care. Whether you have preventative care, like a mammogram or getting care for your heart disease, we want you to continue to get that care safely and believe that you can get that care safely. Or whether that care is in response to the pandemic, such as what Dr. McCreary talked about with the therapies that we have available. So we have the capacity to provide care. At the same time, the pandemic will not be done with the Delta variant. We expect the virus to continue to evolve as transmission happens globally. And so while we're doing well in our regions and for the people we provide care for, so many parts of the world have very low vaccination rates, are under-resourced, and the more the virus circulates, the more likely we will see new variants emerge. So we are trying to contribute both to the clinical care in our regions, to the science that advances the well-being of people in response to COVID-19, and we need to keep in mind that this must still be a global response.
I think the only thing I'll tack onto that to answer the latter part about will the vaccine be effective against variants as we move forward, I will just say in my career, these vaccines are one of the most amazing advances in medicine I think we've ever seen. They're one of the most impressive things that have ever been put out to keep patients safe and to help patients. And so simply, uniquely, these vaccines are built on a platform in which scientists can rapidly adapt that platform should variants emerge. And so there are already teams and teams and teams of wonderful people, including some here at UPMC, that are working on this. And so as variants emerge, testing the vaccines against those variants occurs in real time. And so we will keep the public informed, should anything change with vaccines. But currently, to reemphasize, the vaccines are effective against all known variants.
Okay, thank you. Next question, Bill Kibler, the Altoona Mirror. Bill, please go ahead.
To kind of build on a previous question, what possibly could trigger UPMC to begin recommending vaccination mandates for its employees and especially for nursing home employees?
So this is a continual conversation that we have on a daily or more than daily basis about how do we promote the well-being and safety of our patients and healthcare workers. And while at this point we're not mandating vaccine, it doesn't mean that we won't potentially mandate vaccine in the future. We are doing everything that we can to make sure people are educated, people understand the role of vaccine, that we understand why people have chosen not to get the vaccine, and that we attend to health disparities. So I think a lot is still on the table as this pandemic evolves, and we'll be watching to see how extensive the pandemic is, what the changing variants are, how high we can get our vaccination rates by a trust-building approach.
Thank you. Sarah Bowden, WESA FM. Sarah, please go ahead.
Hi, Hi, good morning. Thanks for taking my question. So I want to build on Bill and Gabriella's question regarding mandated vaccine for staff. I can totally understand why you don't want to mandate it. It's a very difficult decision, and I don't envy that position. However, I'm wondering if maybe you could provide some incentives to employees, maybe additional PTO or bonuses. Is that something that's on the table?
Lots of options are on the table, and we've started with making it widely available. I was incredibly excited to see how well our healthcare workers responded by getting to a very great start with a 70% plus of our healthcare workers vaccinated. And so at this point, continuing to move forward, what responses we have, how we incentivize it, and whether or not a mandatory approach will be effective at getting that rate higher, it depends on why people aren't getting vaccinated and understanding what their needs are. What's it going to take for somebody who's not yet vaccinated to feel that vaccination is the right thing for them? I don't necessarily know that mandatory is the only approach. Obviously, some health systems have taken that approach. And as you point out, maybe incentives are some of that approach. We've seen that at the state level, either a vaccine lottery, financial winnings approach, or, and of course, some places are exploring approaches of trying to ensure safety in other ways without pushing vaccine up. Our approach is educate, understand why people are not getting vaccinated, make sure we attend to health disparities, and do everything else that we've been talking about to make sure it's a safe setting, including masking, which we have not stopped at any point in time during this pandemic, including contact tracing, which we continue to do and have done to the fullest extent possible throughout the pandemic. These together with vaccination create a safe environment.
Okay, thank you. Taylor Toshef of ABC TV in Harrisburg. Taylor, please go ahead.
Thanks for taking my question. I was wondering if you guys could talk about the Delta Plus variant, what exactly that is, and then are you guys also seeing patients coming in with any other different symptoms that we haven't seen, over the past year and a few months?
Let me talk about Delta Plus and variants in general first, and we'll talk about how the presentation differs. We expected from the very start of this pandemic to see some evolution in the virus. And when a mutation happens, sometimes that's to the detriment of the virus. It doesn't perform as well as a virus. And sometimes it serves to the virus's advantage. And that may be in a few different ways. That mutation may either make a person more contagious. It may help the spread of the virus in other ways. It may make a person more sick or sick in different ways. So it may have an ability to cause more or less severe illness in different parts of the body. And it may leave us less well prepared based on how the vaccines or the monoclonal antibodies or other therapies have been designed to work. All of that is possible with mutations that spontaneously arise in this virus. And the more transmission that happens, the more opportunity there is for a virus to emerge with one of these mutations that changes its behavior in some sort of way. Anytime we're talking about variants, whether that's the alpha variant, the Delta Plus, any of the variants, we're talking about accumulations of these mutations. And even though right now in this point in time we're talking about Delta and Delta Plus, there will be another variant with a different accumulation of mutations, including potentially with mutations that we haven't seen yet. So taking the long view on this pandemic, we expect the virus to continue to change. We'll do our very best to adapt with it. And that's why you're continuing to hear from me, from people in public health, that it's important that we do things right now by masking, by distancing, by vaccination. So that is the evolution of the virus. Now, what does it mean for our therapies that we have now? Monoclonal antibody therapies have evolved, as Dr. McCreary talked about, and we have an ability to evolve the monoclonal antibodies so they remain effective to what's circulating. We're going to have to do that to stay one step ahead, and ditto with the vaccine. As the vaccines evolve, we'll have to do that to stay one step ahead as the virus mutates. The best thing we can do is not give it a chance to spread and mutate.
Thank you. Next question, Chandy Chapman, WTAE-TV. Chandy, please go ahead.
Yes, you mentioned two different types of treatment for the monoclonal antibodies. Can you explain the difference in the two different types, please?
Yeah, that's a great question. So the two monoclonal antibodies that we have available right now, the first, casirivimab, indevimab, that's a combination product. So the casirivimab is one type of antibody. The indevimab is another. We give them together in one infusion to the patient, and that's made by one pharmaceutical company. And then sotrovimab is the second drug we offer. It is just one antibody, and it's made by a different company. And so that's probably the main difference, is that it's two antibodies versus one. But what Dr. Snyder talked about a little bit, these antibodies are constantly studied and changed in order to be effective against all of the variants. We actually find them and make them from patients who have recovered from COVID-19, and we screen natural immunity to see which antibodies the human body produces that are most effective at what we call neutralizing the virus or making it not infect your cells. And so then they take those really powerful antibodies and they produce them to infuse as a treatment. Over the course of the pandemic, we've offered 4 different antibodies at any point in time. 2 of them we no longer offer because they weren't very effective at neutralizing some of the variants that were out in circulation, and so we stopped giving them to patients. The 2 that we have now are both very effective, so really either one is appropriate should you qualify.
Dr. McCreary, how many antibody treatments have we provided?
We have given since November, when they first became emergency use authorized by the FDA, we've given 3,448 treatments in total. 2,342 of those have been within the context of our clinical trial, comparing the two to each other.
And how many of the new post-exposure antibodies have we done?
Yeah, good question. So we were ready to go with post-exposure prophylaxis as soon as we heard that the FDA gave emergency use authorization to it last week, just over a week ago. I think we've treated about 14 patients thus far with this therapy, which is great. We were ready to go, and soon we'll be ready to administer all across the enterprise. But again, I just want to plug that post-exposure is wonderful, and I'm glad we have that as an option, but pre-exposure is even better by getting vaccinated if you qualify.
I'm going to state something that's also pretty obvious, but we should reiterate. Monoclonal antibodies don't work if you don't get them, and you're not going to get them unless you get diagnosed with COVID-19. So let me say a word about the symptoms. It remains true from the start of the pandemic to the present that if you have a respiratory virus infection, whether it is a head cold type infection, whether it's a pneumonia type infection, whether it's a flu-like illness, you can't tell from your symptoms whether it's COVID-19 or the virus that caused it, SARS-CoV-2, or another cause, like another respiratory virus. It's important to get tested. When you get tested, even if you have mild symptoms, there is a risk that you will progress to more severe symptoms and complications, including hospitalization or potentially death, as we've seen too many times. If you have symptoms that could be COVID-19, get tested. And when you get tested, if you're positive, think about monoclonal antibody as a potential therapy. It's important to think about it early.
I couldn't underscore that enough. We often get asked in healthcare, would you give this to your mom? I would absolutely give it to my mother. In fact, my grandpa had a COVID exposure, and I made him go get tested 3 times over 10 days whenever he had any kind of temporary, low oxygen level, to make sure he was thankfully negative because he was vaccinated. But I couldn't recommend this therapy enough, and we want to know that all of our patients to know that it's available so that they can access it should they test positive.
Thank you. Next question, Mark Goshagarian from the Spectrum News in Buffalo, New York. Mark, please go ahead.
Thank you. Can you hear me okay?
Speak up.
All right. Thank you. Can you hear me? Is that better?
Yes, go ahead.
Okay. Doctors, you said that the Delta variant is in every region UPMC serves. I suspect that also includes UPMC Chautauqua in Jamestown. What is your message to the residents of the more rural community like Jamestown when it comes to the Delta variant and the behaviors that may be a little bit different from those of some of the larger cities?
Sure, I can take this one to give Dr. Snyder a little break, but our message is the same no matter where you are, where you live, what age you are, race, ethnicity, background, social status. Everyone should mask, distance, and get vaccinated. That it remains to be the best and only ways to prevent getting COVID-19. And from the beginning of the pandemic, we have treated all patients where they are and equally. So that's something we're extremely proud of. I chair our COVID-19 Therapeutics Committee. All 40 of our hospitals run on the same exact treatment guidelines, have standardized approaches to this virus. All of our patients have the exact same opportunities, and we treat them all with the exact same preventative messaging.
Thank you. Our last question is from Jamie Martinez from Spotlight PA. Jamie, please go ahead. Jamie, please unmute on your end.
Can you hear me now?
We can.
Okay, thanks. Dr. Snyder, you mentioned at the top of your comments that mitigation efforts are even more difficult than ever because you're moving around a lot more. Can you just expand on that a little bit and also talk about whether contact tracing is something that's necessary at this stage in the pandemic and why it might be helpful as we head into the fall?
Over the course of the last year and a half nearly, we have started with a pandemic that we hoped we could control, contain, and extinguish. We then moved into a pandemic where we wanted to mitigate the impact. And increasingly, we're facing a pandemic that will be with us for some time. And by some time, I mean will be with us probably at this point for years, because it has spread so significantly globally, and because the virus has evolved significantly and will continue to do so. So while that might be a very grim message that this is a pandemic that all of us want to be done with, but will probably be with us, we've learned quite a bit in a year and a half about how to keep our communities safe, including those who are vulnerable. We know what to do. We can live our normal lives. We can go about our business as a healthcare institution. We can provide care safely for preventative care, for episodic care, for emergency care, even though the pandemic is continuing. We just have to do things safely. And yes, life is going to be a little bit different from here on than it was pre-pandemic, but that's the nature, I think, of a global pandemic. And some of the safest ways we're going to make it through this pandemic until we see its final conclusion, whenever that is to take the appropriate safety precautions, whatever that may be in your situation, but should be considered masking and distancing, and definitely consider vaccination. Get tested if you're not feeling well. Consider the therapies that may save your life.
Okay, thank you. In about 45 minutes, we will email media attendees a link to download high-definition footage of this entire press briefing, which you can use in your news reports. Reporters with follow-up questions are encouraged to contact UPMC Media Relations at upmc.com/media. And please remember to follow @UPMC News on Twitter for frequent updates. Thank you very much.